everyone. Today we are going to present cell injury. So what is cell injury? Cell injury is functional and structural changes in response to various stress over the cell. सेल इंजरी जो होती है उसमें कोई भी फंक्शनल या स्ट्रक्चरल चेंजेस होना किसी भी स्ट्रेस या किसी इंजरियस स्टिमुलाई की वजह से। ये दो टाइप की होती है, रिवर्सिबल सेल इंजरी और इरिवर्सिबल सेल इंजरी। रिवर्सिबल सेल इंजरी में वापस सेल अपनी नॉर्मल कंडीशन में आ जाती है और इरिवर्सिबल सेल इंजरी में सेल की डेथ हो जाती है। सो कॉज ऑफ सेल इंजरी, देयर आर टू टाइप ऑफ कॉज ऑफ सेल इंजरी। फर्स्ट इज जेनेटिक कॉज, फॉर एग्जांपल डाउन सिंड्रोम, सिकल सेल एनीमिया, ऑटो इम्यून डिसीजेस। सेकेंड इज एक्वायर्ड कॉज, डी-अरेंजमेंट ऑफ ऑक्सीजन सप्लाई, एग्जांपल हाइपोक्सिया, डी-अरेंजमेंट ऑफ वाटर एंड ब्लड सप्लाई, एग्जांपल इडिमा, हेमरेज, थ्रोम्बोसिस, infectional, nutritional disease, or physical agent like trauma or chemical.
Pathogenesis of cell injuries. There are 5 steps of pathogenesis of cell injury. First, decreased generation of ATP. Second, cellular swelling. Third, membrane damage. Fourth, mitochondrial damage. Fifth, nuclear damage. Now, types of cell injury. There are two types of cell injury: reversible and irreversible. Reversible cell injury is when the stimulus is acute and brief or more or mild. The cell injury produces changes in the cell which are reversible, and features of reversible cell injury are cellular swelling and fatty changes. Now, irreversible cell injury, if the cell is exposed to continuous injurious stimulus or if the injury is severe, the cell undergoes cell death. There are two types of cell death: necrosis and apostosis. Necrosis, it is always a pathological process, and apostosis may be physiological or pathological.
Apoptosis, programmed cell death, tightly regulated by suicide program, characterized by activation of intrinsic enzyme caspase of the cell that degrades its own DNA and protein. Cause physiological and pathological. Physiological, removal of excess cell in embryogenesis, withdrawal of hormones, endometrial cells during menstruation, elimination of hormone cells, self-reactive lymphocytes. Pathogenesis, DNA damaged cells, radiation, etc. Abnormal protein as in Parkinson's, Alzheimer's, virus infected cells as in HIV, hepatitis.
Gangrene. Necrosis of tissue with superadded putrefaction is known as gangrene. There are two main forms of the gangrene: dry gangrene and wet gangrene. And the gas gangrene is a variant of wet gangrene. First, dry gangrene. Dry gangrene begins in the distal part of a limb due to ischemia, where the blood supply is inadequate to keep tissue viable. Example of dry gangrene in the toes and feet of an old patient due to arteriosclerosis. And the second one is wet gangrene. Wet gangrene occur in naturally moist tissue and organs such as mouth, bowel, lungs, cervix, uvula, etc. Example of wet gangrene are bed sores occurring in the bedridden patient due to pressure on site like sacrum, buttock, and heels. Gas gangrene. It is a form of wet gangrene caused by the gas forming Clostridia gram-positive anaerobic bacteria. In this necrosis, affected area is swollen, edematous, painful due to the accumulation of gas bubbles within the tissue. Later, foul smell comes from the affected tissue and it's become darker black. Gas forming Clostridia gain entry into the tissue through the open contaminated wounds. Example of gas gangrene is gas gangrene of intestine. Hello, today we are here to explain inflammation. Inflammation means burning. Inflammation is response of vascularized tissue to infectious and damaged tissue. It is a body defense reaction to destroy, dilute, or contain the injury.
Cause and types: cell injury due to any cause, infections, necrotic cells, foreign bodies, and hypersensitivity.
Types of inflammation. It has two types: acute and chronic. Acute, short duration inflammatory response, less than 2 weeks, rapid in onset. Chronic, longer duration inflammatory response, slow in onset.
Cardinal signs. Celsus on the first study described 4 signs of inflammation. First, rubor, which is redness. Second, calor, which is heat. Third, tumor, which is edema. Fourth, dolor, which is pain. And Galen later added fifth sign as a functionalisia, which is loss of function. Acute inflammation. There are two types of acute inflammation: vascular events and cellular events. First, vascular events. Vascular events consist of transient vasoconstriction of arteriole, persistent progressive vasodilation, elevate the local hydrostatic pressure, increase vascular permeability, slowing or stasis. And now cellular event, which is marginalization, rolling, adhesion, transmigration, chemotaxis, phagocytosis. Receptors of inflammation. The receptors for recognition of microbes, PAMs, of many microorganisms are recognized by PRR, pattern recognition receptors, of phagocytes and dendrite cell. Example TLR, toll-like receptors. Once these PAMs are recognized by PRR, the phagocytes and dendritic cell start secreting proteins called cytokinins, which is pathogen-associated molecular protein. Complementary proteins directly recognize microbes and produces inflammation.
Inflammation. Definition of inflammation. Inflammation is defined as the local response of living mammalian tissues to injury due to any agent. It is a body defense reaction in order to eliminate or limit the spread of injurious agent as well as to remove the consequent necrosed cells and tissues. Causes of inflammation. The agent causing inflammation are as follows. First, physical agents like heat, cold, radiation, mechanical trauma, etc. Second, chemical agents like organic and inorganic poisons. Third, infective agents like bacteria, viruses, and their toxins. Fourth, immunological agents like cell mediated and antigen antibody reactions. Signs of inflammation. The Roman writer Celsus in 1st century AD named the famous 4 cardinal signs of inflammation as: first, rubor, redness; second, tumor, swelling; third, calor, heat; fourth, dolor, pain. To this, the fifth sign, loss of function, was added later. Redness. It is caused by dilation of arterioles or increased blood flow. Heat. It is caused by increased chemical activity and increased blood flow to skin surface. Third, swelling. It is caused by accumulation of blood and damaged tissues cells. Fourth, pain. Direct injury of nerve fibers, pressure of hematoma on nerve endings, chemical irritants, prednisone, histamine, etc. Fifth, loss of function. Increased pain or swelling is the cause of loss of function.
Good morning, sir. Topic of our group is inflammation.
Definition. Inflammation is defined as the local response of living mammalian tissues to injury due to any agent. It is a body defense reaction in order to eliminate or limit spread of injurious agent as well as to remove the consecutive necrosed cell and tissues.
Causes of inflammation. The agents causing inflammation are as follows: physical agents, chemical agents, infective agents, immunological agents. Physical agents: heat, cold, radiation, mechanical trauma. Chemical agents: organic and inorganic poisons. Infective agents: bacteria, virus, and their toxins. Immunological agents: cell mediated and antigen antibody reactions.
Signs of inflammation. The Roman writer Cellus in 1st century AD named the famous four cardinal signs of inflammation as: first of rubor means redness, second one tumor means swelling, third one calor means heat, fourth one dolor means pain. To these, the fifth sign, functio laesa, loss of function, was later added by virtue. Redness caused by dilation of arterioles as increased blood flow. Heat, increased chemical activity and increased blood flow to skin surface. Swelling caused by accumulation of blood and damaged tissue cell. Pain, direct injury of nerve fibers. Pressure of hematoma on nerve ending. Chemical irritates and bradykinin, histamine, prostaglandin. Loss of function, increased pain and swelling.
Types of inflammation. Depending upon the defense capacity of host and duration of response, inflammation can be classified as: first, acute inflammation, second, chronic inflammation. Acute inflammation. It is of short duration and represent the early body reaction and is usually followed by repair. Its main features are: first, accumulation of fluid and plasma at the affected site. Second, intravascular activation of platelets. Third, polymorphonuclear neutrophils as inflammatory cells.
Second, chronic inflammation. It is of longer duration and occurs either after the causative agent of acute inflammation persists for a longer time, or the stimulus is such that it includes chronic inflammation from the beginning. The characteristic feature of chronic inflammation is presence of chronic inflammatory cells such as lymphocytes, plasma cells and macrophages. Thank you, sir.
Our topic is inflammation. What is inflammation? Inflammation is a protective response against body or body itself. या कह सकते हैं रिस्पॉन्स बाय वेस्कुलाइज्ड टिश्यू टू इन्फेक्शंस. Then inflammation during repair, the injured tissue is replaced by regeneration of native parenchyma cells or feeling of defect by fibroblastic tissue or both. Or inflammation and repair are protective response against the body. Causes of inflammation: infection, injury, autoimmune, environmental factors that can trigger inflammation.
Here is the symptoms of inflammation: common physical symptoms, systematic symptoms, chronic inflammation symptoms, variation in symptoms based on the affected body parts. Can inflammation cause considerable harm to the body? They may include harm. Example like anaphylactic reactions, rheumatoid arthritis, arteriosclerosis, pericarditis. Then what happens? Inflammation in terms when the offending agent is inflamed and the secreted mediators are broken down or dissipated. There are active anti-inflammatory mechanisms that serve to control the response and prevent it from causing excessive damage to the host. What are the cells and molecules that play important roles in inflammation? Blood leukocytes, plasma proteins, cells of vascular walls, cells of surrounding connective tissue, ECM of the surrounding connective tissues.
What are the types of inflammation? There are two types of inflammation: acute inflammation and chronic inflammation. What is the difference between these two types of inflammation? Acute inflammation, rapid in onset, repeatedly short duration, lasting for minutes, several hours, or a few days. It is main characteristic the exudation of fluid and plasma protein, the emigration of leukocyte, predominantly neutrophil. Chronic inflammation is of longer duration, associated historically with the presence of lymphocyte and macrophages, the proliferation of blood vessel fibrosis and tissue necrosis, and it is less uniform.
Acute inflammation. Local clinical signs of acute inflammation: heat, redness, swelling, pain, loss of function. Redness in forearm, swelling in legs, swelling in knee joint.
What are the two major components of acute inflammation? Components of acute inflammation: vascular changes, vasodilation, alterations in vessel caliber resulting in increased blood flow, increased vascular permeability, permit plasma proteins to leave the circulation. Cellular events: immigration of the leukocytes from the microcirculations and accumulation in the focus of injury. Principal leukocytes in acute inflammations are neutrophils, polymorphonuclear leukocytes.
Treatment options for inflammation: non-steroidal anti-inflammatory drugs, corticosteroids as anti-inflammatory agents, immunosuppressants for managing autoimmune related inflammation, complementary and alternative therapies for inflammation management.
Welcome everyone. In this video we will study about the inflammation. Now what is inflammation? Inflammation is a response of vascularized tissue infection and damaged tissue. It is a body defense reaction to destroy, dilute or contain the injury. Now the signs of inflammation. Inflammation mainly shows 4 signs: rubor, redness, tumor means swelling, calor means heat, dolor means pain. Redness is caused by dilation of arterioles or increased blood flow. Heat, which is caused by chemical activity and increased blood flow to the skin surface. Swelling is caused by accumulation of blood and damaged tissue cell. Pain is caused by direct injury to nerve fiber, pressure of hematoma ending, chemical irritation, bradykinin, histamine and prostaglandins. Loss of function, which is caused by increased pain and swelling in the body. Now the type of inflammation. Depending upon the defense capacity of the host and duration of response, inflammation is of 2 types: acute and chronic. Acute inflammation. It is of short duration and represents the early body reaction. It shows mainly 2 features: accumulation of fluid and plasma at the affected site, intravascular activation of platelets, and polymorphonuclear neutrophil as inflammatory cells. Chronic inflammation is of longer duration and occurs either after the causative agent of acute inflammation persists for a long time or the stimulus such as that it induces chronic inflammation from the beginning. It is characteristic feature of chronic inflammation is presence of chronic inflammatory cells such as lymphocytes, plasma cells and macrophages. Acute inflammation is caused by allergic reaction, chemicals, infection, trauma, burns, etc. Acute inflammation converts to chronic inflammation and causes cardiovascular disease, neurological disease, autoimmune disease, lumps, cancer, etc. Causes of skin inflammation is heat rash, autoimmune disease, infection, allergic reaction, sun damage, and photosensitivity. Inflammation can occur in the case of cancer, cardiovascular disease, Alzheimer, pulmonary disease, arthritis, autoimmune disease, and neurological diseases. Inflammation can be treated by these medications: antihistamines, aspirins, non-steroidal anti-inflammatory drugs, glucocorticoids, and others. Ayurvedic treatments like yoga, pranayam, dietary modification, medication, sound therapy, panchakarma, rasayan, prayers, herbs can also treat inflammation. Thank you very much.
Everyone, let us talk about inflammation. So, what is inflammation? Response of living tissue to injury due to any agent. मीन कोई भी एजेंट की वजह से जो इंजरी हुई है उसके रिगार्डिंग बॉडी रिस्पॉन्स करती है, उसे हम इन्फ्लामेशन कहते हैं. अब व्हाट इज डेफिनेशन ऑफ इन्फ्लामेशन? Definition: a localized physical condition in which part of body become hot, red, swell and painful, especially as a reaction to injury or infection. Inflammation बॉडी एक प्रोटेक्टिव रिएक्शन है. तो जब ये रिएक्शन होती है तो इंजरी पार्ट जो होता है वो रेड, स्वेल और वॉर्म होने लगता है. इसे हम इन्फ्लामेशन के साइन एंड सिम्टम भी कंसिडर कर सकते हैं.
Now we talk about causes of inflammation. Inflammation is due to so many causes. Here are some. Physical. Physical can be mechanical, as in car accident or injury due to assault, or environment like severe cold and heat burns. Chemical examples are acid burns, drugs, venom, etc. Infections like bacterial infection, viral infection due to fungi and other parasites. Ischemia, lack of or restricted blood supply, which may eventually lead to death of tissue, necrosis known as an infarct. Immune, autoimmune condition and allergies, and there are many other inflammation, causes of inflammations like necrotic cells, infection, hypersensitivity, and foreign body particles.
Now we talk about types of inflammation. There are two types of inflammation: acute inflammation and chronic inflammation. First, acute inflammation. It is the immediate and rapid response to injury which is of short duration. It is characterized by fluid and plasma protein exudation and by leukocyte infiltration. Examples of acute inflammations are sore throat, burns, and insect. Now the second one is chronic inflammation. Now we talk about chronic inflammation. It is defined as an inflammatory response of prolonged duration in which tissue destruction and inflammation occur at the same time.
Can be recognized clinically by 5 cardinal signs. First one is rubor, which is redness; calor, which is warmth or particular site; tumor means swelling; and dolor, which is pain; and last one is loss of function. These clinical signs can be explained by the biochemical and cellular processes activated during the inflammatory response. Rubor and calor are the result of local vasodilation, and remaining tumor, dolor, and loss of function result from extravasation of blood plasma, white blood cells, and inflammatory mediators.
Inflammation. Inflammation is a response of vascularized tissues to infections and damaged tissues, or it's a body defense reaction to destroy, dilute, or contain the injury. Causes: cell injury due to any cause, such as due to infections, necrotic cells, foreign bodies, or hypersensitivity.
Types of inflammation. There are two types of inflammation: acute inflammation and chronic inflammation. In acute inflammation, there is a short duration of inflammatory responses, less than 2 weeks, and a rapid in onset. And in chronic inflammation, there is a longer duration of inflammatory responses and it is slow in onset. Cardinal signs. There are 4 signs of inflammation, which is rubor, calor, tumor, dolor, and last is functional loss. Receptors of inflammation. Receptor of inflammation includes receptor of recognition of microbes, which includes PAMP of many microorganisms, and recognized by PRR, which is pattern recognition receptor, example toll-like receptors, and second, complementary proteins. Now, second is receptors of recognition of dead and necrotic cell part, which includes DAM, which is damage associated molecular pattern, and cytosolic complex called inflammasome.
Mediators of inflammation. There are 2 types: A. Cell-derived mediators of inflammation. B. Plasma protein-derived mediators of inflammation. A. The cell-derived mediators of inflammation. There are 7 types: histamine, serotonin, cytokinase, chemokinase, platelets activating factors, free radical. B. Plasma protein-derived mediators. There are 4 types: kinase system, clotting system, fibrinolytic system, the complement system.
Mechanism of inflammation. Acute inflammation can be divided into 2 major events: vascular event and cellular event. Vascular event includes hemodynamic changes and increased vascular permeability. In hemodynamic changes, arterial dilation, increased blood volume in microvasculature, slowing of blood flow in microvasculature, and in increased vascular permeability, endothelial cell contraction, direct endothelial injury, leukocyte-mediated vascular injury. The migration of leukocyte from blood vessels include following steps: margination, rolling, adhesion, transmigration. Two main types of phagocytic cells are neutrophils and monocytes.
Morphological types of acute inflammation. First, serous inflammation, for example, skin blister formed in a burn or viral infection. Second, fibrinous inflammation.
Outcomes of acute inflammations are resolution, fibrous healing, suppuration, chronic inflammation, membranous inflammation, pseudomembranous inflammation, and gangrenous inflammation, and it is also called necrotizing inflammation.
The topic for our presentation is necrosis. Now let's begin. What is necrosis? Necrosis is a type of cell death associated with the loss of membrane integrity and leakage of the cellular contents, causing dissolution of cells due to the degradative actions of enzymes. And these enzymes are lysosomes and migrant WBCs. Necrotic cells become digested and phagocytosed or become calcified. Necrotic focus surrounded by inflammation. It's mean that the necrotic area surrounded by the inflammation. Now the picture shown here about how the normal cells become the necrosis or it lead to the necrosis. If the cells recover, then it become normal cell. Or if cell do not able to recover, it become irreversible and it leads to necrosis. Now general causes of necrosis: poisons and toxins, chemicals, strong acids, alkalis, insecticides, mercury, etc. Infectious agents: bacteria, virus, fungi, protozoans, etc. Plant poison, hepatotoxic alkaloids, circulatory disturbance like anemia, congestion, etc. The mechanical injury are cutting, crashing, and rubbing types. Physical: the extreme temperature, electricity, or free radicals are the general causes of necrosis. Now the morphology of necrosis. There are cytoplasmic changes occur, nuclear changes also occur. So the cytoplasmic changes occur. All cytoplasmic organelles materials are digested by enzyme. Lysosome of dead cells digest the dead cell. This process is called autolysis. The leukocytes lysosomes also digest the dead cells. This process is called heterolysis. The nuclear changes occur are karyolysis, nuclear shrinkage, fragmentation of piconative nucleus.
Types of a necrosis. There are 6 types of a necrosis: coagulative necrosis, liquefactive necrosis, gaseous necrosis, fat necrosis, fibrinoid necrosis, and a gangrene. So, the coagulative necrosis. Form of a necrosis in which the underlying tissue's architecture is preserved for several days. The affected tissue has a film structure mechanism, usually due to ischemia, denaturation of structural and enzymatic proteins, blocking complete proteolysis of dead cells, micro. Conversion of a normal cells into their tombstones, outlines of the cells are retained. Example of a coagulative necrosis are kidney, liver, spleen, heart. There is a picture which is shown the coagulative necrosis in the cortex of the kidney. Then the second, liquefactive necrosis. Type of necrosis in which the dead cells are completely digested, transforming the tissue into a liquid viscous mass mechanism. Degradation of a tissue by the action of a powerful hydrolytic enzymes, micro. Cystic space containing necrotic cells, debris, and macrophages filled with phagocytosed material. Example are bacterial and fungal infections, sepsis, hypoxic brain injury, and the cerebral infarcts. There is a picture given below of the liquefied necrosis in the liver and the brain. Third, the caseous necrosis. Type of necrosis which resemble dry cheese, soft granule, and yellowish texture. Combination of a coagulative and liquefactive necrosis are of a caseous necrosis. Mechanism. Histotoxic effect of the lipopolysaccharides in the capsule of a tubercle bacilli, micro. Amorphous granular pink appearance, example foci of a TB infection. There is a picture given below where the upper portion of a lung in the patient with the tuberculosis is suffering from the caseous necrosis, here with the confluent cheesy.
Fat necrosis means local areas of fat destruction. In its mechanism, liberation of pancreatic lipase from injured or inflamed tissue occurs. The lipase split the triglyceride esters in the fat cells into fatty acids. The fatty acids combine with calcium to produce grossly visible chalky white areas. These areas are known as or form fat saponification. At microscopic level, you can see shadowy outlines of necrotic fat cells with basophilic calcium deposits. Like example, traumatic, which occurs in breast, and enzymatic, like in pancreatitis. In this slide, you can see the fat necrosis at Dross level, and in the next slide, you can see the fat necrosis at microscopic level. Fibrinoid necrosis. It is a form of necrosis characterized by deposition of fibrin-like material which has the staining properties of fibrin. In its mechanism, deposition of complexes of antigens and antibodies in the walls of arteries takes place. At microscopic level, brightly eosinophilic hyaline-like material deposition in the vessel wall surrounded by nuclear debris of neutrophils can be seen. Example, vasculitis. In the next slide, you can see vasculitis at its macroscopic level.
Gangrene or massive necrosis, there are two types, dry gangrene and wet gangrene. Wet gangrene have subtype called gas gangrene. Dry gangrene ischemia and coagulative necrosis. Wet gangrene ischemia plus secondary infections, liqueficative necrosis. Gas gangrene, subtype of wet gangrene associated with Clostridium welchi. Clostridium welchi produces gas in subcutaneous tissues. Thank you.
Very warm greeting everyone. This is a video presentation of the topic necrosis done by the group of Anjali Nair, Twinkle Rathore, Devyanshi Sharma, Sneha Jain and Sanskruti Wankhade. Necrosis is a form of cell injury which results in the premature death of cells in living tissue by autolysis. The term necrosis came about in mid-19th century and is commonly attributed to German pathologist Rudolf Virchow, who is often regarded as one of the founders of modern pathology. Necrosis is caused by factors external to the cell or tissue, such as infection or trauma, which result in the unregulated digestion of cell components. In contrast, apoptosis is a naturally occurring programmed.
Causes of necrosis. Ischemia means reduced blood flow. Whenever is ischemia leads to hypoxia means decrease in oxygen. When hypoxia prolonged leads to infraction. Physical agents in which external injuries are occur. Third, chemical agents in which toxin, venom, poisons are included. Fourth, immunological injuries in which natural killer cells and macrophages are included. Types of necrosis. First, coagulative necrosis, colligative necrosis, fat necrosis, fibrinoid necrosis. Some other types are also there. Gangrene, also known as massive necrosis, in which two types are there, dry gangrene, wet gangrene.
Coagulative necrosis. It is caused commonly by localized ischemia. Ischemia means reduced blood flow. Coagulative necrosis leads to development of localized area of coagulative necrosis called as infarct. The most common sites where coagulative necrosis affects are heart, kidney, and spleen. Myocardial infarction, cerebral infarction, pulmonary infarction, splenic infarction, renal infarctions. Colligative necrosis. It is also called as liquefactive necrosis. It is caused by suppurative infections and it is pus forming. Example of colligative necrosis is streptococcus, ischemia of brain because of presence of abundant lysosomal enzyme. Colligative necrosis leads to abscess cavity filled with creamy yellow semi-fluid material pus. The gross changes are complete digestion of cell and pus formation. The microscopic changes is liquefied necrotic cell, dead leukocytes, and macrophages.
Caseous necrosis is cheese-like necrosis, coagulative and liquefactive necrosis. Causes: tuberculous infections, type 4 hypersensitivity reactions, and it leads to combined features of both coagulative and liquefactive necrosis. Gross changes: necrotic area resembles dry cheese and are soft, granular, and yellowish. Microscopic changes: necrotic area is called granuloma. Its center has fragmented or lysed cells surrounded by epithelioid cells, Langerhans type giant cells, lymphocytes, and fibroblasts. Fat necrosis. Adipose tissue necrosis. Enzymatic fat necrosis occurs in adipose tissue around acutely inflamed pancreas. Mechanism: in pancreatitis, the enzymes leak from acinar cells and causes tissue damage. Lipase destroys fat cells and liberates free fatty acids which combines with calcium and form calcium soaps. Gross: appears as chalky white areas. The necrotic fat cells appear pale with shadowy outlines surrounded by an inflammatory reaction. Traumatic fat necrosis occurs in tissues with high fat content following severe trauma.
Fibrinoid necrosis. It is fibrin-like deposition. It is characterized by deposition of fibrin-like material, not fibrin. It is usually seen in immunological tissue injury. Example of fibrinoid necrosis is autoimmune vasculitis, transplant resection, etc.
Gangrene, massive necrosis. Gangrene is massive necrosis with superadded putrefaction. Types: dry gangrene and wet gangrene. Wet gangrene, subtype of gas gangrene. Norma area, line of demarcation between normal and gangrenous area. Dry gangrene, dry massive necrosis. Generally involves distal part of lower limb, foot or toe. Resembles coagulative necrosis. Causes usually due to arterial occlusions, example atherosclerosis. Gross appearance, affected part is dry, shrunken, dark brown or black, resembling foot of money. Line of demarcation is present between gangrenous and adjacent normal tissues. Microscopically, smudging of soft tissues and overlying skin. Line of demarcation consists of granulation tissues with inflammatory cells. Wet gangrene, wet massive necrosis. Wet gangrene is seen in moist tissues like bowel, lungs, mouth, etc. Resembles colligative necrosis. Causes usually due to venous occlusions, example volvulus. Gross appearance, affected part is soft, swollen, putrid and dark. Microscopic appearance, affected area has intense inflammatory exudates, thrombosed vessels and numerous bacteria. Example, bed sores in an immobilized patient. Diabetic foot contains both dry and wet gangrenous features.
Good morning, sir. Our topic is cell necrosis.
Definition of necrosis: spectrum of morphological changes that follow cell death in living tissues.
Causes of necrosis: ischemia, physical agent, chemical agent, and immunological injury.
Types of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis.
Coagulative necrosis: preservation of general tissue, architecture, tombstone, appearance of the cell. Affected tissue is film, denaturation of structure, protein, and enzymatic digestion of cells. Examples: heart, kidney, spleen.
Liquefactive necrosis: the tissue become liquid, viscous mass. Material is creamy yellow in color, seen in brain abscess.
Caseous necrosis: type of coagulative necrosis seen in tuberculous infection. Tissue is cheesy white in appearance. The tissue architecture is preserved. Fat necrosis seen in pancreas, breast. In acute pancreatitis, activated lipase causes fat necrosis. Grossy, visible chalky white areas, presence of shadowy outlines of necrotic cells.
Fibrinoid necrosis: deposition of fibrin-like material seen in immunological cell injury, hypertension, peptic ulcer. Thank you.
Of necrosis, spectrum of morphologic changes that follow cell death in living tissue. Causes of necrosis: ischemia, physical agent, chemical agent, immunological injury.
Pathogenesis of necrosis: first, denaturation of intracellular proteins, second, enzymatic digestion of the cell. Morphology: cytoplasmic changes, increased eosinophilia of cytoplasm, glassy homogeneous appearance, cytoplasm is vacuolated, moth-eaten, calcification of dead cells, appearance of myelin figures, generation of calcium salts.
Nuclear changes. First, karyolysis, fading of basophila of chromatin due to DNA's activity. Second, pycnosis, nuclear shrinkage and increased basophilia. Third, karyorrhexis, fragmentation of pynotic nucleus. Type of necrosis: first, coagulative necrosis, second, liquefactive, third, caseous necrosis, fourth, fat necrosis, and fifth, fibrinoid necrosis. First, coagulative necrosis: preservation of general tissue, architecture, tombstone appearance of the cells. Affected tissue is firm, denaturation of structural proteins and enzymatic digestion of cells. For example, heart, kidney, spleen. Second, liquefactive necrosis. The tissue becomes liquid viscous mass. Material is creamy yellow in color, seen in brain abscesses. Venous necrosis, wet gangrene, dry gangrene, gas gangrene. Wet gangrene occurs in moist tissues like mouth, bowel, lung, cervix, diabetic foot, then bed sores. Next, about dry gangrene, toes and feet due to arteriosclerosis, thromboangiitis obliterans, Ryan disease, trauma. Then, gas gangrene. Wet gangrene caused by gram-positive anaerobic bacteria seen in muscle and in colon. Then caseous necrosis. It is a type of a coagulative necrosis seen in tuberculosis infections. Tissue is cheesy white in appearance. The tissue architecture is preserved.
Fat necrosis, seen in pancreas breast. In acute pancreatic activity, lipase causes fat necrosis, grossly visible chalky white areas, presence of shadow outline of necrotic cell.
Fibrinoid necrosis, deposition of fibrin-like material seen in immunologic cell injury, hypertension, peptic ulcer. Thank you.
Necrosis. Necrosis is an accidental and unregulated form of cell death. Let's talk about type of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, gangrenous necrosis. Number 1 is coagulative necrosis. When blood flow to the cell stops or slow is called ischemia. It can occur anywhere in the body except the brain. The cells and the tissue maintain their structure after death. Eventually, immune system clears that cell. It includes atherosclerosis, blood clots, hernias, infection, and injuries or trauma. The next one is liquefactive necrosis. The liquefactive necrosis transforms the tissue into liquid viscous mass. It occurs due to bacterial abscesses and the CNS infarction of the skin. Often it is associated with focal bacteria or fungal infection. Neutrophils release lysosomal enzymes that digest the tissues. Now, the next one is caseous necrosis. It is a type of necrosis causes tissues to become cheese-like in appearance. Frequently, the caseous necrosis is encountered in the foci of tuberculosis infection, and it can also be caused by syphilis and certain fungi. Its common causes is TB, systemic fungi, example Histoplasma, Capsuculum, and Nocardia. Now the next one is gangrenous necrosis. Gangrenous necrosis is a massive type of necrosis. It is of two types, dry and wet necrosis. It occurs in distal extremities and GI tract after chronic ischemia. Now the last one is fibrinoid necrosis. Fibrinoid necrosis is a death of cells in small blood vessels. It can lead to bleeding and internal damage throughout the body. Many conditions can cause fibrinoid necrosis, including malignant hypertension and autoimmune disease. Thank you.
Morning. Our topic of presentation is necrosis. Introduction. Necrosis is the death of body tissue through disease or injury. Necrosis is the death of cells in living tissue caused by external factors such as infection, trauma, or toxins. Necrosis is the pattern of cell death that occurs in response to injuries such as hypoxia, extremities of temperature, toxins, physical trauma, and infection with lytic viruses.
Morphology of necrosis: cellular swelling or rupture, denaturation and coagulation of cytoplasmic proteins, breakdown of cell organelles, breakdown of nuclear DNA.
Patterns of necrosis in tissue or organs.
coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis, and gangrenous necrosis.
Coagulative necrosis. It's a form of tissue necrosis in which the component cells are dead but the basic tissue architecture is preserved for at least several days. The affected tissue takes on a firm texture. Presumably, the injury denatures not only structural proteins but also enzymes and so blocks the proteolysis of dead cells. As a result, eosinophilic anucleate cells may persist for days or weeks. Ultimately, necrotic cells are removed by phagocytosis of cellular debris. Example of coagulative necrosis. Morphology in growth. Foci of coagulative necrosis in early stage are pale, firm and slightly swollen. With progression, they become more yellowish, softer and shrunken. In microscopic, infarcted cells are converted into tombstones. Their outlines are maintained. Nuclear and cytoplasmic details are lost. Leukocytes digest necrotic cell.
Liquefaction or colligative necrosis due to ischemic injury or bacterial or fungal infection. Degradation of tissue by the action of powerful hydrolytic enzyme. The common examples are infract brain and abscess activity. Whatever the pathogenesis, liquefaction completely digests the dead cells, resulting in transformation of the tissue into a liquid viscous mass. If the process was initiated by acute inflammation, the material is frequently creamy yellow and is called pus. Morphology. In growth, the affected area is soft with liquefied center containing necrotic debris. Later, a cyst wall is formed. In microscopic, the cystic space contains necrotic cell debris and macrophages filled with phagocytosed material, proliferating fibroblast.
Caseous necrosis. Found in the center of foci of tuberculosis infections, it combines feature of both coagulative and liquefactive necrosis. Term caseous, cheese-like, is derived from the friable yellow-white appearance of the area of necrosis. Morphology. In gross, foci of caseous necrosis, as the name implies, resemble dry cheese and are soft, granular, and yellowish. This appearance is partially attributed to the histotoxic effects of lipopolysaccharides. Microscopically, inflammatory reaction consisting of epithelioid cells with interspersed giant cells of Langerhans or foreign body type and peripheral mantle of lymphocytes.
Fat necrosis. Fat necrosis refers to the local areas of fat destruction. Acute pancreatic necrosis, traumatic fat necrosis, commonly in the breast, pancreatic enzyme that have linked out of the SR cells and ducts liquefies the membranes of the fat cell in the peritoneum. Lipase splits the triglycerides ester contained within the fat cells to fatty acids. This combines calcium to produce glossy visible chalky with the areas that is known as fat sponification. Morphology. Morphology of gross. Fat necrosis appears as the yellowish white and the firm deposits. Formation of the calcium sorbs impacts the necroid fossiliforms and the chalky white appearance. Morphology of microscopic. The necrosed fat cells have the cloudy appearance surrounded by the inflammatory reaction.
Fibrinoid necrosis, characterized by deposition of fibrin-like material which has the staining properties of fibrin. It is encountered in various examples of immunological tissue injury, immune complex vasculitis, autoimmune disease, arthritis reaction, arterioles in hypertension, peptic ulcer. Morphology. Morphologically identified by brightly eosinophil, hyaline-like deposition in the vessel wall. Necrotic focus is surrounded by the nuclear debris of neutrophils. Local hemorrhage may occur due to rupture of blood vessels. Fibrinoid necrosis, nuclear debris, viable PMNS, fibrinoid.
Gangrenous necrosis. It is of two types, which is dry and wet gangrene. There is difference between dry and wet gangrene. Site, commonly in limbs, in wet in bowel. Mechanism, arterial occlusion in dry and venous obstruction in wet. Microscopy. Dry, shrunken and black, whereas in wet it is soft and swollen. Line of demarcation is present in dry and no clear-cut line is present in wet.
Thank you.
So our topic of presentation is necrosis. So what is necrosis? Necrosis is the death of cell in your body tissues. Necrosis can occur due to injuries, infection or disease. Lack of blood flow in your tissues and extreme environmental condition can also cause necrosis. While dead body tissues can be removed, it can be brought back to good health. And here we watch different patterns of necrosis like coagulative necrosis, liquefactive necrosis, caseous necrosis, fibrinoid necrosis, and two more. Let's see them in detail. And here's first type of necrosis, that is coagulative necrosis. With coagulative necrosis, the dead cell remain firm and look normal for days after death. Lack of blood flow or oxygen to any part of your body except your brain can cause coagulative necrosis. Second type of necrosis is caseous necrosis. Caseous necrosis. With the caseous necrosis, the dead cell look white and soft. They have been described as looking like cheese. The word caseous means cheese-like caseous necrosis is uniquely seen in infectious lung disease or tuberculosis. Third type of necrosis is fat necrosis. With fat necrosis, damaged cell release enzyme, causing them to turn to liquid. The liquid cell combined with calcium, white deposit on the cells. Acute pancreatitis is the most common cause of fat necrosis. It can also occur in breast tissues. Another type of necrosis is fibrinoid necrosis. With fibrinoid necrosis, the dead cell appear pink and lack structure. This because plasma protein, which is called fibrin, are leaking out of your blood vessels walls. Fibrinoid necrosis occur when an autoimmune disease or infection damage to your blood vessels. Next is gangrenous necrosis. With gangrenous necrosis, your skin appear black and is beginning to rot. Lacking of blood flow to your legs can also cause gangrenous necrosis. It can sometimes affect your arm and finger too. The last type of necrosis is liquefactive necrosis. With liquefactive necrosis, the dead cell partially or completely dissolve within hours of death. Then they transform into a thick, sticky liquid. The cells sometimes appear creamy yellow because pus is forming. Infection and loss of oxygen to your brain can cause liquefactive necrosis. Types of necrosis, like necrosis can affect many different areas of your body, include your bones, skin, organ. The different type of necrosis includes: first type of necrosis is avascular necrosis. Avascular necrosis goes by many names. Osteonecrosis, aseptic necrosis, and bone necrosis are all other terms of avascular necrosis. Avascular necrosis occur when blood flow to your bone tissues is blocked. Lack of blood flow to your bones cause them to break down and eventually die. Hip necrosis is most common form of avascular necrosis. Next is osteonecrosis of jaw. Osteonecrosis of jaw is a type of avascular necrosis. Osteonecrosis of jaw is a mouth disorder that occurs when cells of your jaw bone die. Osteonecrosis of jaw can cause severe mouth and jaw pain. In addition, pus may ooze from your mouth and jaw. Third is acute tubular necrosis. Acute tubular necrosis or tubular necrosis is a kidney disorder. When the tubule cells of your kidney are damaged, it can lead to acute kidney failure. Tubule cells are tiny duct of your kidney that help filter your blood when it passes through your kidney. Next is fat necrosis of breast. Fat necrosis of breast is a non-cancerous condition that can occur when fatty breast tissue is damaged. Your body usually replaces damaged breast tissue with scar tissue. With fat necrosis, some fat cells die instead of forming scar tissue. This forms a pocket of greasy fluid called as oil cyst. Next is renal papillary necrosis. Renal papillary necrosis is a kidney disorder that can occur when the renal papillae of your kidney die. The renal papillae are the opening of tubes, that is duct, that enter your kidney and pass pee, means urine, into your bladder. Next is radiation necrosis. Radiation necrosis is a rare side of high dose radiation to your brain, head or neck. It can result in the permanent death of brain tissues. Pancreatic necrosis. Pancreatic necrosis is a serious complication that can develop due to acute pancreatitis. When the blood supply to your pancreas is cut off, it can cause your pancreatic tissue to die. When this happens, your pancreas becomes infected. The infection can spread into your blood and cause organ failure. Okay, next is how to identify necrosis. Swelling of cell, swelling of nucleus, karyolysis means nuclear dissolution, karyoexis means nuclear fragmentation, nuclear pycnosis, paleophilic cytoplasm, and many more. Causes of necrosis. Necrotic tissue form when not enough blood and the oxygen that blood carries reach the affected tissue. Blood clot and blood vessel damage are just two of many causes that can trigger necrosis, injury, infection, chronic disease, and toxins that block blood flow to an area and cause necrotic tissue to form in that area. Some more causes like injury, infection, infraction, disease, toxins, etc. Next is treatment. Treatment may include surgery to restore blood flow or to remove the damaged tissue, antibiotics to prevent or treat infection. Some more medical treatments like removal of tissue, medication, hyperbaric oxygen therapy, tetanus immunization, and many more. Okay, thank you.